Hey everybody, my name is Holly Nichols and I am an ER nurse, and my issue today to talk about is vaping. So the issue that I have chosen to discuss and why is for years vaping was marketed towards adults to help try and stop smoking. And that was a successful move, and it really helped a ton of people stop smoking cigarettes and improve their health. Over the last several years, mostly since around 2012, a huge issue with vaping has been that these companies have began marketing towards teenagers. They use flavors like gummy bear and watermelon, and have little devices that are as small as a flash drive that are used to vape or use an e-cigarette with, that are very easy to hide from teachers and parents. And it's becoming an issue that teenagers are actually starting smoking much earlier than before. For years, teenage smoking had been decreasing. Children trying cigarettes for the first time had really started taking a sharp decrease, and now more than ever, use of e-cigarettes among teenagers is continually rising every year. One problem with that is that the marketing regulations for vape companies, companies such as like the Juul company, don't have the same regulations that cigarette companies have. So they're actually able to market with commercials and not really have the same warnings featured on them that a cigarette company has to have on a traditional cigarette pack. In 2016, the FDA did become involved with the e-cigarette companies, and now they do require them to meet FDA regulations. So one of the main issues is that in 2019, there have so far been 530 cases of lung disease that has been caused directly from e-cigarette use, reaching from, just simple pneumonia all the way up into respiratory failure, where, you have children in the ICU that are intubated due to the effects that these e-cigarettes have caused on the lungs. Another issue is that now it is becoming more popular to smoke marijuana out of a vape, and that is unregulated, and the THC is actually causing harmful effects, increased lung disease in these teenagers who are using the THC in the vapes. Another issue is that, considering vaping is so new to our society, we don't know the long-term future effects. Similar to cigarettes, when back way when people first started smoking cigarettes, you were unaware of how serious the health consequences would be from that. It is similarly this way with vape, as no one in the future quite knows yet the health effects that this is going to have on a long-term person. It's very important in the community for parents and healthcare workers and also lawmakers to be involved in this. Parents have to talk to their kids and be actively involved to make sure that their kids understand how serious this is. And then healthcare workers have to make sure that when they see patients coming in with these advanced stage lung disease and just sick kids, that the first questions they're asking are, have you been using vapes or any kind of e-cigarette that could cause this? And then most importantly, which is who I would like to reach out to, the lawmakers, because this is just such a poorly regulated system. It's so easy for children to gain access to these products over the internet, and there's really no consequences for these companies selling to minors, because it is so easy for them to gain access over the internet. So my target audience would be the lawmakers who are able to enforce stronger federal regulations on these companies and improve regulations to where children are not able to gain access to these. My resolution that I would like to enact, I actually have more than one. my first one is that you need stronger regulations on marketing. All the marketing to children should be completely halted. All of the flavors that are marketed towards teenagers and younger generations, such as gummy bears and cotton candy, those don't need to be available to children or anyone, because, this should be solely used as a resource to stop smoking. And then also, to require a prescription from a healthcare provider to obtain an e-cigarette. Other similar marketing is done for like Chantix to stop smoking, so an e-cigarette requiring a prescription would definitely help to cut down the access this has to our younger generation, and hopefully leave the vaping to people who truly need it to stop smoking. This is a very serious thing, and I think over the years it's going to come more, we're going to see more health issues related to it. So that's why I chose vaping as my healthcare resolution paper to, come up with a solution for all these children that are using these e-cigarettes. Thank you.